Southeastern Occupational Health Works began in 1999. Local employers had expressed a need that they wanted their employees to go to one location so they could get comprehensive care to a provider that understands workers' comp and understands the importance of returning that employee back to work. So as a result of that, Occupational Health Works began, and since that time we have served over 500 different companies in Robinson and the surrounding region. We offer comprehensive health care for business, industry, and employees. We do health testing for employers as far as before employees actually begin work in order for them to meet their standards for the American Disabilities Act or for Occupational Safety and Health Administration. A big part of what we do is to treat work-related injuries. An employer may call us and tell us that they have an employee that needs to be treated. They would give us authorization to treat that employee, and then we would treat that employee from the beginning of the injury until they are back to their pre-injured state. We case manage those employees, case manage with the actual workers' comp insurance companies, so that the employee can get the best health care that is possible. Services that we would provide would be, the injury care. We do physical agility testing to match that employee with that job. This is proven to reduce actually work injuries in the workplace. The pre-employment physicals is not to discriminate against an employee. It is only to see if there are issues that need to be resolved before that employee actually starts work. We do audiometric testing, sometimes pre-employment, sometimes annually. We also do pulmonary function testing or respiratory fit testing, and that is to check lung capacity of different employees. A large part of what we do is pre-employment drug screening or after injury drug screening or alcohol breath testing. Companies will do random drug testing, which is a very good thing for companies to do. That way they know that their employees are drug-free, which reduces injuries. Many times we have actually been able to diagnose someone's hypertension or diabetes by them coming in for an injury from the company. Part of treating that injury is treating the whole body as well. So they might not even know that they have had elevated blood pressure readings until we have seen them initially, and then in follow-up and make the diagnosis of hypertension. Miss Gabrielle Neal, which is a PA that works with me, and I actually go on site to different companies that we provide services to. By doing that, we can see the employees actually at work. We see what restrictions that an employer could accommodate, and so we may do drug testing there, random drug testing. We can do vision testing, on site. During flu season, go on site, and several of our companies will give their employees flu shots. We also go on site to do educational classes like a bloodborne pathogen class. They may ask us to do a class on stretching or on safety for their employees. We are also looking for safety hazards that may be a potential injury for that company to try to help them prevent those injuries that may occur on the site. We actually have a partnership with the companies. They welcome us coming on site so that we will understand what their employees are doing and what work restrictions that they can accommodate. We do that to provide excellent care for our employers and the employees. Dr. Thomas Florian is our medical director. Dr. Florian is a physiatrist. A physiatrist actually treats physical medicine. All of our staff is trained and certified in doing urine drug screens. We have some staff that is certified in doing pulmonary function testing, respiratory fit testing, alcohol breath testing, and then an audiometric. I do physical agility testing, and that is matching that employee with that job. I also attended a certification program at Duke in occupational environmental medicine, so I'm certified in that. I'm also certified as an occupational hearing conservationist. We are a part of Southeastern Regional Medical Center. At times we need to refer our patients out for things that are beyond our scope of practice. It's not only physical health that we may need to refer a patient out, but also for psychological help. We can make referrals to the Employee Assistance Program. Our mission is to always provide excellent care to our employees and our employers. A lot of people don't even know that we're here. They think that when you say occupational medicine, that it is more like taking care of our own hospital employees, but we provide services for hundreds of different companies. If any company is interested in sending their employees here to Southeastern Occupational Health Works, they could contact our office. Our number is 272-9675, and then our marketing liaison would contact that company and then give them all the information they would need. We have posters that we have the companies to put up in their work site so that then if maybe the human resource manager is not there when an injury occurs, then the employees know that they can come here for their injury care. After 5 o'clock, when we are closed, then those companies then send their employees to Southeastern Regional Medical Center Emergency Room or Southeastern Urgent Care in Pembroke. I've been a hospital employee for almost 26 years now, and it is a wonderful feeling to come to work and enjoy your job and enjoy the excellent service that you provide for not only the company but for the employees as well.